Medical abortions are a safe and effective way to end a pregnancy, though the decision to have one is highly personal. If you need this procedure, know that you are not alone in the process. This video is here to guide you on all that you need to know on medical abortion. So, I will be explaining what a medical abortion is. A medical abortion is a procedure that uses prescription pills to end a pregnancy in the early stages. And the most common regimen involves taking two pills, the mifepristone and the misoprostol. The mifepristone blocks the progesterone, that is the hormone needed to support the pregnancy, while the misoprostol causes cramping and bleeding to empty your uterus. A medical abortion is a non-surgical way to terminate a pregnancy in the first trimester. So why is a medical abortion performed? Depending on your circumstances, having a medical abortion is a highly personal decision. Someone may choose to have a medical abortion because they are concerned about passing an inherited disease to the child, while some people might choose a medical abortion because they are carrying a pregnancy or the pregnancy could be life-threatening, or rather they want to end an unwanted pregnancy. Everyone's situation is different. So reaching out to a healthcare provider who understands your medical history and your healthcare needs can help you weigh your options. A medical abortion isn't a safe option if you are too far along gone in your pregnancy, if you are allergic to the medications used, if you have a pregnancy outside of your uterus that is an ectopic pregnancy, or if you have a blood clotting disorder, or rather you don't have access to an emergency care if you are in the process all by yourself. Now, what do you do to prepare for a medical abortion? A medical abortion involves taking pills by your mouth or through your vagina. First, you will have to take the mifepristone to end the pregnancy. Then you will take the misoprostol to empty your uterus. Following the instruction as prescribed will do you good. Mifepristone works by blocking the hormone progesterone. Without progesterone, your uterine lining will thin and the pregnancy won't stay attached. While taking the misoprostol causes your uterus to contract, bleed, and expel the pregnancy. The medicines come in pill form, like I said. You will have to take them through your mouth or through your vagina. Most people feel the most effect from the medicine shortly after taking the second pill, that is the misoprostol. How long does a medical abortion take? A medical abortion takes about 2 to 6 hours after you have taken the second pill, the misoprostol. Although it may take longer in some cases, but you must plan to rest during this time. It's a good idea if you have someone you trust with you, someone you know you can trust with the whole process, so they can provide you care and comfort. Or you can better still ask your healthcare provider which medications you should take to manage the pain and when you should take them. For example, it may be a good idea to take a pain reliever half an hour before taking the misoprostol, depending on the instruction given by your healthcare provider. So what can you expect after a medical abortion? You must expect vaginal bleeding and cramping. Cramping are the biggest side effects, while the heaviest bleeding typically occurs several hours after taking the second pill, that's the misoprostol. You may have period-like bleeding for several days afterwards, or you may have light to moderate bleeding for several weeks. So how long do you bleed after a medical abortion? The amount of bleeding varies from person to person. It also depends on how far you were in your pregnancy. So expect heavier bleeding for 1 to 2 days. Bleeding will typically lessen over 2 to 3 weeks. You may need to wear sanitary pads. Of course, it's important until the bleeding stops. Using these pads will help you track the amount of blood and know when you need to see your healthcare provider. I know you might want to ask, what are the risks in taking a medical abortion? Of course, medical abortions are considered safe and effective. Though complications are rare, but it's important to take all medications as prescribed, not doing your own thing. Skipping a dose or not following instruction can pose health risk. There are no long-term risks associated with medical abortions. So how long does it take to recover from a medical abortion? Recovery time varies. Most people start feeling better the day after the last pill. You may be able to resume normal activities within a day or two. Just pay attention to your body and take it easy if you need to avoid certain activities that will cause you pain. Recovery isn't always just physical. You may feel a range of emotions, from relief of sadness, stress, or the guilt, depending on the circumstance that led you to a medical abortion. These feelings are normal. It may be helpful to speak with a mental health professional, like a therapist, about how you're feeling. And if you need help processing these things, you can ask your provider for recommendations on medical health professionals who can provide you the support that you need. Now, how soon after a medical abortion can you have sex? I know this is the big question, but you must know that you need to wait at least 2 to 3 weeks to have intercourse after a medical abortion. This is to prevent vaginal infections. You shouldn't insert anything into your vagina during this time, no matter what it is. Medical abortion shouldn't affect future pregnancies unless there were complications. Your healthcare provider can help you so you can understand exactly what's involved before, during, and afterwards. So that is why it is advised and very important for you to have someone you trust, a healthcare provider that you can share some of this to, and who will lead you and be with you in the process of the abortion. They can connect you with resources you may need to process any emotions you are feeling throughout the experience. Your healthcare provider or the team is there to make sure that you are comfortable and you are receiving the care that you need. And don't forget that you need to follow every instruction as given to you by your healthcare provider or in the package of the pills that you will be using for the abortion. So if you haven't subscribed to this channel, why not hit the subscribe button